Hello everyone and welcome to Love Qualified. It's your girl Joanny here. Today I am going to be telling you guys all about my first week back on my GP placement as a final year physician associate student. So I've just come to the end of my second week at GP, but during my first week I vlogged every other day during the week just to map out my thoughts, to document my thoughts on everything that was going on during that week. I had started editing, but unfortunately yesterday, I don't know, because my I have an iPad and an iPhone. They're linked together, so the stuff on my iPad is also on my iPhone, like stuff like that. And I think I meddled with some of the videos on my phone. I deleted the videos on my phone, thinking that they would stay on my iPad, but they deleted from my iPad as well. So I lost the footage that I took from that first week, apart from one video which I'm gonna leave at the end because that was a wrap-up video that I did. But I'm sorry guys, so today I'm just going to be talking to you guys what GP has been so far, and just showing you guys some photos and little videos that I posted on Instagram over the last 2 weeks. You can still see my face and still hear me talk. I hope you guys are well. We're living in currently, tortuous times, and there's a lot of emotions and things running high. In the midst of all of this, as students, we still have to learn, even during a pandemic like this. So I just thought that I would just let you guys know how GP has changed. Remember that at my university, St. George's, last year in first year, we had GP placement once every week. So I went to that practice every Wednesday. For that reason, I only met some of the doctors. I didn't meet all of the staff. There's loads of receptionists, loads of the HCAs, and loads of other nurses as well that I didn't meet. But this year it's been great because I'm going the Monday to Friday. I'm there for 6 weeks. I just finished week 2, so I've got 4 more weeks to go, and it's been an amazing experience so far. And I think one of the major reasons is because I really love the staff at my practice. I really love the practice. They're very welcoming. I remember last year I used to be so nervous every Wednesday going to GP because I had my own clinics. I saw my own patients in the morning and in the afternoon, and I presented back to my supervisor, and then we saw the patient together. So that's basically what I was doing last year. But this year everything has changed, and I'm going to talk to you guys about how that has changed. So just a quick recap. In second year at my university, it's placement based, so I have been on placement since September. I have been fortunate enough to do my geriatric medicine placement, my obs and gynae placement, my mental health placement, my pediatrics placement. Then I did 3 months so all these placements I've listed were for 3 weeks each. Then I did 3 months of my acute medicine placement. It was long. After that, I was supposed to go to GP, then ED, which is emergency medicine, then general surgery, then my elective. But because of the whole pandemic, we were off placement for 2 months. So that means a significant part of my GP placement and my emergency medicine placement was taken off. But anyway, my university has managed to pull some strings and get us back onto placement for 12 weeks. So I've got 6 weeks in general practice and 6 weeks in emergency medicine. So I'm missing out on general surgery and my elective. But to be fair, I don't really mind. I'm not complaining. Anyway, back to GP. On my very first day, I went. My supervisor was so nice. Like, she had told everyone in the practice that I was coming back, and just letting everyone know that this is a student from last year, this is what she's going to be doing, and blah blah blah. So she gave me a bit of a rundown on how things have changed, what things were like when the pandemic just started, how they had to decide on doing things, the discussions they had on how to run the practice, because the practice has 2 sites, but they're not very far away from each other. It's like a 5-minute drive between the 2 sites. But then the doctors, they work across both sites anyway. As you all know, with GP, every doctor has their own list of patients that they see every day. But now at my practice, the way they've done things now is that they have one list, and you have the doctors across the two sites who pick off that list. So you have the palliative care list, you have the under 5, so that the children under 5 years old, then you have the urgent list, then you have the non-urgent, then you have the routine calls, and you have some follow-up calls as well that you need to do. And those are calls that you have every day. So then they book these patients in, but they do telephone calls. So a lot of the consultations now are telephone consultations and video consultations as well, depending on what the situation is. And then sometimes we have face-to-face consultations where there are certain things where you just can't assess over the phone. So things like lumps, you can't assess over the phone. Abdominal pain, you can't really. Sometimes you can do a video consultation and get the patient to sort of like do a abdo exam for you, but that's kind of hard because you need to feel the abdomen. There's so many organs in the abdomen, so you need to feel the abdomen to properly assess the patient. And also patients who have had like repeated calls, you've spoken to them over and over and over, but the problem is not really resolving. I think those are the situations where the doctors would have to think twice and be like, okay, this person can come in for a face-to-face assessment. When they do come into the practice, so the doors are locked, they have to ring the bell, and then the doctor and whoever, the clinician who is seeing the patient, would dress up full PPE, face masks, goggles, apron, gloves, and then they would go down, open the door, get the patient in. And then the plan is to not spend over 15 minutes with the patient. So you do what you're supposed to do, assess the patient, blah blah blah, and then you lead the patient back out the door. Hopefully the patient doesn't touch anything in the practice, and if they touch anything, you have to clean after the patient. And when you get back to the room, you have to wipe down the chairs, wipe down everything, all the equipment that you use. So basically that's how it's been, that's how it is. But majority of the consultations are telephone and video. Anyway, so I had that bit of a rundown, like from my supervisor explained everything to me, and she was so nice that she made a timetable for me. So remember last year I didn't meet as many doctors. I only worked with 2 of my supervisors, the nurse practitioner, one of the nurses, and that was it. But this year they gave me a timetable, so I'm with different doctors every day of the week, and different doctors in the morning and in the afternoon, and I am going across both sites as well. Before I wasn't sure how I was going to manage, if I was going to like having to drive between both sites, but I think I'm used to it now. And like I said before, both sites are not very far away from each other, so it's good. I've had the opportunity to meet all the other doctors I didn't meet last year, the nurses, the nurse practitioners, the HCAs, and they're all so lovely. Monday, what I did with my supervisor is I sat in some of the consultations, telephone consultations. So she put it on speaker, and when she called the patient, she would tell the patient, there's a student in the room and you're on speaker. Do you mind if the student listens into a conversation? And the patient would be like, no. A lot of them have said, no, I don't mind. There's not been anyone who has been like, nah, can the student get out? So they're very, very receptive. And then with some of the doctors, they would ask me questions in between, like we just discuss. So basically when the patients are booked in, the receptionist puts in the reason why the patient's calling, or why the patient wants to be called. And so before going to the call, my supervisor would ask me, okay, so if, for example, knee pain, what are the things that you'd want to rule out? If someone's coming with a testicular swelling, what are the things that you would want to rule out? So we discuss that, then we take a history, and then after that the doctor will ask me a few more questions. It's been amazing because everyone has different ways in which they teach, but they're very, very open to teach me. Like it's been so good. Like they're so willing to teach me and to ask me questions and to get me to do things. And so as the week went down, my supervisor encouraged me to do my own telephone consultations. So she picked a patient up from the list, and then she gave me to go and ring them. So I called the patient and be like, I'm working with this doctor today, but they've asked me to take a full history from you, and then I'm going to discuss with the doctor, and then one of us will call you back. Either the doctor, or if it's a straightforward thing and the patient doesn't mind speaking to just me, I can tell them what the plan is, and this will all be documented anyway. So yeah, my supervisor gave me a couple of patients. I called them, and none of them have ever refused to speak to me first. So I take a full history from them, go back and present back to my supervisor, tell that we'll discuss a plan, and then if it's straightforward, they tell me what the plan is, and then I go and ring the patient back. If the patient has any questions, or if they want to speak to the doctor, they would say yes. But so far, no one has ever been like, no, I don't, I want to speak to a doctor, I want to speak to a doctor. But if it's more complicated or more complex, or the doctor wants to clarify a few things I didn't take out from the history, the doctor would call the patient back, and I would sit and listen in as they explain to the patient. I did mostly in the first week, and then my supervisor also encouraged me to do a video consultation on my own with a patient who was in a nursing home who was bitten by a squirrel. So she told me to take history from the patient, ask her what happened, and to assess the bite and to see if it's infected. Bless her, she was so nice. The software is so cool. Like, you can send text messages, you can send a link to the patient, they have to download this thing, and then both of you click on that link, and then it opens up in the computer, and then you can see the patient. It's just like, technology is, when it works, it's amazing. The patient was fine, the wound wasn't infected, but any animal bites in the hand, really, they have to be covered. They have to give them prophylactic antibiotics. She wasn't very keen on it, but I had to explain to her that, you have to take antibiotics. This was after I discussed with my supervisor anyway. I think I've been tested a lot on, obviously, getting my taking a good history, like taking a detailed history, coming up with differentials, and then thinking up on what are you going to do next, because that's the whole step up from first year. It's not just about differentials anymore. Like, we're way past that step. I should be knowing at this point, having an idea. When I think of a presenting complaint, I should be having an idea of what I want to rule out, the most life-threatening things, and then asking questions to rule out and rule in certain diagnoses. Like I was told, like one of the doctors told me, one of the doctors I was working with, she made me take a history from her. She thought of a case that she had seen, or a patient that she had seen, and she was like, okay, this is a good one. For example, diarrhea. I'm going to be a 39-year-old female, take a history from me. So she was like, we're going to get you good, we're going to get you concise, we're going to get you precise in presenting back. Come on, Joan, you can do it. Yeah, it's been amazing to have all these opportunities to do all these different things, but also them encouraging me to think of what am I going to do next. So this is a case, and you have to think it's just your rationale, your thought process, and why you're deciding to do these things, the way you think about it. Because with everything that you decide to do in general practice, you have to be safe, and also you have to give a reason for why you're doing these things. Because when they look at your notes, when your colleague looks at your notes the next time, that you have to document a reason for why you're doing things. You need to justify the reason why you do things. You don't just do things out of the blue. Every single specialty has their good and bad sides. And I think with general practice, the fact that you get this range of patients, like you can never know what the next patient's going to be about, and it keeps you thinking on your feet. Answer these patients' questions, you get what their concerns are, you make sure that they're safe, so you have to give them safety netting advice, like, tell them what to look out for, any red flags, if things are worsening, if they're not getting any better, what they're supposed to do. So for example, if they're supposed to go to A&E, or if they're supposed to call back. The pathways that you send patients down under, because general practice is the first point of contact, and then you as a general practitioner have to decide, or a clinician working in general practice has to decide where to send that patient or what to do. So yeah, that's one of the challenges of general practice. So they've been trying to groom me, get me think about how to deal with different situations, basically justifying my actions really, and challenging me on some of my management plans and stuff. But yeah, so some of the things that I've come across. So what I did in my first week is that I wrote down like the history taking model, like Socrates, and like reminding myself to ask red flags and review of systems and ICE and all that kind of stuff. But just because I had been out for 2 months without taking proper history, so I'd gotten out of it a bit. In terms of the kind of conditions I've been seeing, there's been a lot of hay fevers, a lot of ear infections. I've had to do swabs a few times because patients have been having persistent ear infections. Usually we don't do swabs for ear infections, we just treat them anyway. You just look at in the ear, and if you see if it's otitis externa, for example, you just treat them. But patients have been having persistent ear infections with discharge and some UTIs, urine infections, little ones coming in as well with conjunctivitis and just other little infections here and there. I'm getting a lot of knee pains, shoulder pains, a lot of MSK related problem, a lot of bites as well, insect bites, squirrel bite, a lot of infections like sore throats. and thrush as well, oral thrush, vaginal thrush. There was a shingles at one point that I got, and I had a patient who came in with a breast lump that we had to end up referring under the 2-week rule to be assessed in the breast clinic and for querying breast cancer. This was one of the patients that I clerked on the phone, and then we had to, like I said, we have to, with lumps, we have to look at lumps because bring the patient in to be assessed. So yeah, there's been some coughs as well, there's been some abdo pains. We had a patient who we called who was in a nursing home who had been rapidly deteriorating, and when we spoke to the community nurse looking after the patient, we found that it was a possible COVID-19 case. So we had to get the acute home service team to go and see the patient. Some testicular swellings I've seen, upper leg swellings as well, querying DVTs or phlebitis or some sort of form of cellulitis, mouth ulcers, rashes. I had a patient who came in with a rash, which could have been just an allergic rash, but it looked more like vasculitis, and so I had to read up a bit on that one and the different causes of vasculitis. For example, starting new medications could be due to bacterial infection or just a viral rash really. I've had pain in the groin, and I think one of the doctors got me to think about it, like you go systematically what is there. So it could be something on the skin, like is it shingles or whatever, or is it a hernia, that's musculoskeletal, or is it a lymphoma, or just getting to think about different things like that. Essential hypertension, sleeping problems, mental health problems as well, anxiety, depression. And then we had a right upper quadrant pain, a lot of UTIs as well, and then a lot of skin conditions, so some lesions. We had a patient who was querying melanoma. We had to refer under the 2-week rule to be assessed by a dermatologist. I have had to read up on quite a few conditions to test my explanation and planning skills. So for example, I had to read up on menopause and precocious puberty, because there was a patient who called in. She thought she was having hot flushes, or she was going through the menopause. So I had to explain to her about what menopause is, what HRT is, the risks and benefits, and all of that stuff. And I had to explain to her, and also the lifestyle modifications and the different things that you can do to help with the symptoms. So yeah, they encouraged me to read up on that and to call the patient and discuss with her. There was a day when I had a patient who came with frothy urine, thinking about the fact that protein in the urine can make urine frothy. So we had to encourage the patient to come and drop in samples so we could dip it, check for blood, check for protein, because it could be some sort of interstitial kidney disease like glomerulonephritis. I had a lot of situations where I would present back to my supervisor, tell them what I think it is and what we should do next, and they've agreed with my diagnosis and my plan, and it's just been amazing, because obviously last year I had no idea what was going on and I had a lot of patients I was seeing who came in with presenting complaints that we hadn't studied. So a lot of the times I was just like, I don't know how to treat this, I don't know what is going on. But I feel like now, because we've finished learning everything and it's just time for me to consolidate my knowledge, I always know something to a certain degree. I might not know it well, like especially the guidelines in detail, but I have some sort of idea. And it's always nice when you get something right, and it's just like, that revision is paying off. There's been a lot of lumps as well, and diarrhea, PV bleeding, menorrhagia. These are all different presenting complaints I've had. So you see, general practice is so broad. This patient as well, a young patient who had symptoms that seemed like costochondritis, so he was having chest pain. And also thumb pain as well, which could have been some sort of arthritis, like thumb osteoarthritis or rheumatoid, or just overuse of the thumb really. Query asthma for patients that had a persistent dry cough and wheezing, abdo pain. And yeah, so that's what I've had over the last few 2 weeks. What I've been doing when I get home is I've been trying to be reading up more on different conditions, and my favorite book is Oxford Handbook in General Practice. Hang on one second, I'm gonna get it for you. So yeah, I am a little bit biased, but I love this book. I think they were saying there's another edition coming out. I got this last year for my birthday, and there's another edition coming out already. But oh well, if you're interested in working in general practice, or if you just want to learn for your general practice placement, I cannot recommend this book enough. It's just amazing. I just love it. I could not read my notes, I could just read this. It has all the different systems, all the different conditions, well, not all of them, but like the major ones that you have to know for general practice. And in all the different systems, like peds is here, Jerry's is here, mental health, there's a whole section about mental health, infectious diseases, GI, GI, resp, cardio, renal, MSK, even derm is here with some pictures as well. I've been reading this during my break on placement, and also when I get home I've been reading this because it's been helping me a lot. Yeah, so that's what GP has been like over the past 2 weeks, I guess. And now I guess I am going to leave. I'm gonna put the next video here. I just wanted to come on here and say that that was my first week of general practice. So things have changed quite a bit. If you did watch my vlogs from last year, because I did vlog a few times through my weekly vlogs, and I vlogged what I learned on Wednesdays and what I was allowed to do. You know, I'm not seeing as many patients face to face, but I'm still getting in contact with patients via telephone, video consultation, and seeing some patients face to face as well. Yeah, I'm so grateful for, you know, the way things are going. So I have, even though it's different from what I was hoping or what I'm used to, I have still been learning loads from the patient contact, the patients that I've been seeing, and it's been helping consolidate my knowledge. It's different, but I'm still grateful because I'm still learning and I still have this opportunity to be on placement and still see patients, and patients are still willing to talk to me as the student, and I'm just glad that I can be part of the team and help in the little possible way that I can. But yeah, that's my week, my you know, how my general practice is going. I will most likely do a whole wrap-up video after my 6 weeks is over, like I did for my other rotations, and just tell you guys my whole general experience in general practice, and give you guys some tips and tricks on how to get the most out of your general practice placement, especially post-COVID, how you can help, what has helped me, what I've learned, and what can help you too. But yeah, thank you guys so much for watching. If you have any more questions about placement, be it general practice or my previous rotations or anything at all about PA school, let me know in the comments down below and I'll be more than happy to answer. Thank you guys so much for watching. Have a lovely day and God bless. Bye.